Sharon, I believe that we have all but one panelist here, so I think we can go ahead and get started.
I don't think Sharon is on the call, Renika. Sorry, that's just me.
Oh, that's you. Sorry. Okay.
Yeah.
Well, hello, everyone. Thank you for your patience as we wait for people to get into the meeting. I'm going to try and do Sharon's housekeeping as best as possible, but this meeting is being recorded. We will post it onto our YouTube channel as soon as it is uploaded. So be looking for that if you want to rewatch, take notes. And we also have live notes going on. So if you need those, we also have those available as well. I think that's about everything. So I am going to start off by allowing the panelists to introduce themselves, and I will start with Matthew Gower.
Hello, this is Matthew Gower. I'm here with Amanda Lewis and our new program coordinator, Cody Azabache. Can you hear us?
Yes.
All right.
Thank you.
This is the first time we've used conference call technology in a while, and we kind of forgot how to use it.
No worries. And Victor Liu.
Good afternoon, everyone. Glad to be here. So my name is Victor Liu. For this work context, I use he, him, his pronouns. I'm the Director of Practice Innovation from Asian Counseling and Referral Service.
Thank you. Ava, Ava's Zhang.
Hi, my name is Eva Zhang, and I'm a student at Cleveland High School. And yeah.
Thank you. And Kayleen Chung.
Can you hear me?
Yes.
Perfect. Hi, I'm Kayleen Chung. I use she, her pronouns, and I'm the program manager at Community for Youth.
Thank you. So to get started, our first kind of general question is how has COVID-19 affected mental health, particularly for students in communities of color? And I will call on Matthew Gower for this question.
So COVID-19 has impacted everybody, regardless if you've been near somebody who's caught the virus, had the virus yourself, just due to a lot of the mitigation impacts and the overall stress that comes with having an impending outbreak around you. Most people throughout the state have reported experiencing depression, anxiety, and in some form throughout the summer. We do believe that towards October and again around the holidays, that these feelings will increase, possibly leading to an increase in suicidal ideation and attempts and increased substance use disorder resulting in emergency room visits. When it comes to people of color, those effects tend to be exacerbated by the lack of resources and a lack of outreach, to be perfectly honest. A lot of the stress statewide tends to come from the fact that a lot of our social networks, our routines have been impacted greatly. And some of our tribal partners, they have been unable to do a lot of their spiritual practices, including like sweat lodges, community gatherings, and a lot of their normal rituals due to the outbreak and the mitigation. And this has disrupted a lot of people's ability to get the support that they need. If you kind of break it down and think about how we would typically reach out for support for somebody, we don't go to a stranger, we don't call a hotline. We pull aside a trusted community member, a friend, a family member, and we just talk to them. You know, if we're having a hard time at work, we tend to meet up with our friends and talk about work and work through those emotions together. The outbreak has really disrupted our ability to do that, and a lot of people have been isolating and kind of allowing these things to build up. The lack of normal social interactions has been one of the primary drivers of people feeling anxious and isolated. And as I said before, in a lot of communities of color, a lot of our rituals, a lot of our social interactions are very dependent on being around each other. Sharing of food and a space, and being able to interact with each other on that level. We don't have very good data on exactly how much it's been impacting communities of color exclusively, but we do know that with the social disruptions that's being felt across the state, that is one of the huge drivers, and that often tends to be one of the larger drivers for people who still have very strong cultural practices.
Thank you. Victor Liu?
Thank you, Matthew, for sharing the information about how COVID-19 has actually impacted youth, specifically of people of color. In this case, I will also be referencing to the BIPOC individuals. And Matthew, I'm so glad that beyond mental health, you also raise substance use disorder issues, because with COVID-19 or not, when it comes to mental health issues among youth or BIPOC individuals, oftentimes it's a co-occurring issues that also include substance use disorder. So I really want us to be thinking about, during this time, COVID has also impacted behavioral health issues that includes both mental health and substance use disorder. More specifically, I would say that access is really a critical piece that is increasing the behavioral health issues. Yes. So for instance, for BIPOC individuals, most individuals may be of low or no income, may have lacked digital literacy with no access to technology. And a lot of the works in behavioral health settings, we are providing it through telecommuting at this time. And it's something that, even though the federal governments and local and nationally had allowed a lot of flexibilities to use telecommuting or telemedicine, telehealth as the means of service to provide behavioral health services. But think about it from this perspective. If it's a youth of color that lives of low or no income, they already may not have a private space at home, because oftentimes they may be living in a crowded home setting. So you won't be able to provide that counseling. So if they need to talk to somebody about depression, alcohol and drug issues, it becomes even more challenging. And then that creates even more barriers and challenges for them to access services. So I would, and then beyond that, school just resumed session. And if I recall correctly, it's a 4-day school. There's an expectation that the remote learning has to happen between 9 a.m. to 3 p.m. almost on a daily basis, 4 days a week. And think about that. From that perspective, if somebody has a mental health or alcohol or drug issues, I just cannot imagine how they are able to access services, already have no access to technology, already have no access to private space. And remote learning not only causes stress for the youth themselves, but also for the family members.
Thank you for sharing that. Kayleen?
Yeah, so one of the biggest things that we're seeing, along with what Victor was sharing too, is a lot of domestic abuse happening at home as well, domestic violence. I think a lot of times stress levels of both parents and students are kind of rising, especially in this day and age, and just with everything happening and the social unrest that's happening in our world, that it's kind of building more layers of stress and kind of uncertainty of what the future holds, which then kind of creates a very tension space in the home for students, where they're having to work from home, but study from home as well, you know? And so when we're trying to figure out on how best to support our students of color specifically. We're running into these barriers of knowing how to provide that specific help, and where our boundaries are in terms of community providers and support systems for our students and our mentors. And so our program specific is really helpful in terms of having one-on-one support between mentors and students, and it provides that extra layer of support. But what we're finding is our mentors aren't having the right resources to provide their students with the appropriate level of care and check-in points. And so that's something that we're also trying to figure out as well.
Thank you. Two things before I continue. I wanted to say to our panelists, feel free to jump in on the questions whenever. I don't need to call on you. If you have anything to say, please share. And second thing for our participants, don't forget, if any questions come to your mind, don't forget to drop them in the chat, and we will try to get to as many questions as we possibly can. So I want to stay to that question, but for Eva, I want to change it from a student perspective. Is how has COVID-19 affected your mental health personally or your peers, if you're willing to share, during all this, what are we, like month 7 now of kind of quarantine? So I think we would love to hear your thoughts as well.
Okay, so with COVID-19 and mental health, I feel like it's affected a lot of young people, and it's affected like a lot of us in many different ways. And like I feel like a lot of us at school and stuff, we were able to project like how we felt to our friends and stuff. But like now everything, we just bottle everything up inside. And I've seen like with my friends and stuff, like there's just been a lot of like negative things happening this year, and like there was just so many negatives, and everyone is just like kind of over online school, and everyone's so stressed out. It's like also hard to like focus in school and look at a computer screen for 6 hours of the day, and then have to look at the computer screen like even more after, because you have to do like homework and schoolwork. And so like I have seen like a lot of my friends, they've been isolated, and like they really haven't been talking to no one, and like sometimes like we don't know how to like project that out, and sometimes we have to like adapt to the teachers, and we have to adapt to the learning environment. And I feel like with everything going on, like I feel like teachers should be like a little bit more understanding, and they should do like more like mental check-ins, like, and if they can't talk to their students, like each and every one of their students, like you make a Google Doc to where like students can like type in how they feel, and like then if you see like you can come in and help a student out, then I feel like teachers should like try and help as much as they can, because that's like their only interaction, if that makes sense.
That makes complete sense. Thank you. So honestly, jumping off of what you just said is, and this is for all panelists as well, is what can schools be doing to check on their students' mental health?
I feel like schools could be doing more like interactions, like with social media. Everything's on social media now. Like teachers have Instagram accounts, teachers have all these like, they have Twitters and stuff now. And I feel like if teachers are more interactive through social media and building bonds through off of social media, it just makes it where it's a safer environment for like us students to be able to go to our teachers. Like on Instagram, you can have polls, you can have Q&As, you can be playing music with pictures, and like Instagram could be like educational, it could be informational. Like it's not, I feel like everyone looks at social media negatively when like you can turn it into something positive. And so I feel like the power of social media with like learning right now is like a really important key with everything going on, and since everything is virtual anyways, you know?
Yes, I love that idea of using social media, especially like Instagram. Like you said, there's so many features on all of these social media platforms that it could really be used to get students together, and not necessarily an educational setting, or it could be, but also just to kind of socialize with their peers from a distance. I would love to hear from Kayleen or Matthew, Victor, Amanda on some advice for what teachers or schools could be doing.
Yeah, I just to jump in here and kind of piggyback off of what Eva was sharing too. I think one of the really big aspects of being an adult working with a young person is really understanding the concept of having to come down to their level. I think that as adults in a working professional stance kind of expect us to be on almost like an even level playing field. And I think that it's unrealistic to expect that a young person could meet you there, especially in the time and age that we're living in, and not having the proper types of resources or just having that in-person connection. And so really getting creative with how you're connecting with your students, with your young people is a really great way. I would say one of the ways that we've been able to connect with our community of young people is TikTok, right? Like finding creative ways to make videos and dances to really kind of engage with young people on that platform. It not only helps the rapport, it also helps kind of rebuild this type of relationship that can sustain throughout the whole year, that won't necessarily need to rely on an in-person type of connection. I'll also find a lot of times that students are a lot more excited when they find out, you know, older adults are kind of on these platforms and kind of using their own creativity to engage. And I think that that's been a really cool way to connect, but also to kind of show that you are willing to learn from them, that you're willing to connect with them, and you're really willing to go out of your way and your kind of comfort level of getting to understand that student, which then kind of helps prepare the foundation and the rapport to be able to have the harder conversations of like, how are you? Like, how is your mental health? Like, I'm noticing these things, like what's up here? Like, let's check in. It kind of helps create that sense of connection and community that I don't think a lot of adults feel comfortable with, because there's a different generation gap, right? There's a generation gap of feeling comfortable of posting things online, whereas with adults, we're kind of taught to fear the internet. And so when we're able to kind of figure out how to harness that level of knowledge and just kind of that creativity, it opens up so much more connection and so much more room for community to be able to have the harder conversations and not feel so invasive. Because I think that a lot of students, if there's no connection and there's no rapport, it can feel really out of place to be checked in on or to be asked about personal things or personal mental health questions.
Thank
This is
you.
Amanda Lewis, Healthcare Authority, and just to add to that, I think those are wonderful comments, and just wanting to kind of reemphasize the importance of, I think, Ava, what you had mentioned, just kind of creating that space and conversation to hear from young people about what they're experiencing right now, and to really listen to and create solutions and resources around what they're feeling and what solutions that they're suggesting to everything that they're experiencing, versus from an adult or teacher or counselor perspective, assuming we know what they need right now, and just really being able to kind of hear that young person's voice and to think about kind of co-creating different solutions and that sense of community and conversation together. With just this environment that we're in, it's just so unprecedented that we can't really assume or know what youth are experiencing right now.
Victor, would you like?
Oh, I just unmuted myself. You are a psychic.
Perfect.
No, kidding aside, I really like the idea that, Eva, you brought up about you integrating social medias to provide behavioral health services to the youth. But then I'm sure Matthew and Amanda from HCA will attest to what I'm about to say. It's the whole idea with behavioral health services, the importance and needs for privacy and confidentiality. So I'm not sure that the platform of Twitter or other social, Instagram, or other social media platform can be something that behavioral health or healthcare providers can actually use in partnership with the school administrators, because we have to abide and govern and protect the privacy of the youth and clients and family members that we work with. That said, though, I do believe in innovative solutions that we can actually figure out. So if we were to perhaps use Instagram or other social media platform as an engaging platform, but not to provide clinical services, I think there are ways to do it by having restricted or limited groups. And if it's an open-ended group, then I think it's completely fine to do something that it's fun. The key here, I think, is what Amanda, you had touched on co-creating and co-collaborating with the youth that are receiving the services or engaging in that creative platform to receive services. Because oftentimes I just see healthcare or behavioral health providers or even educators, school administration that is very prescriptive. The school basically had decided that this is what I want you to do, ABC. There is no way of flexibility around it, which I just personally think that is very rigid. And again, if we come from a BIPOC individual's perspective, a lot of the things that are being done may not be accessible. And I also believe that services that are provided in a behavioral health setting, whether we're doing it in an open-ended way or a confidential virtual platform, it can be accessible, it can be fun, and then it's also something that we want to be able to allow the youth not only to co-design the program and tell us what is the engagement platform that makes most sense and interactive, but also allow them to perhaps even co-lead a program or a group. And also I emphasize on really making it fun. And I just think that during this very unusual time now with the smoke and everything, I think it's even more critical that in a very stressful life, whether it's adults or youth, we want to be able to incorporate fun elements in the work that we do or in the program design that we attempt to implement.
Awesome, thank you. So I've personally just read like a few articles here and there, just talking about the overall effects of COVID-19 on youth and children's mental health, all of us really, but particularly those groups. And I'm wondering, are these mental health surveys that organizations are putting out there, that government officials are putting out there, are they being translated into different languages to support communities? And I will call on Matthew and Amanda to start off.
Can you tell me more about, you said surveys?
Yeah, so I can try and pull up surveys, but I've read a few different articles about, and not necessarily just in Washington State, but in states around the country where organizations are putting out articles, or like I know that DSHS I've gotten personally like a few calls of them doing like surveys of, a lot of it has to do with like mental and behavioral health around COVID, but from my knowledge, it's all in English. And I'm just wondering if there's any surveys or resources being translated to go out to communities of color in communities that English is not their first language.
Oh, that's a really good question. I don't know if I have a good answer for the survey portion, and not being too familiar if they are offering that in other languages. And maybe Matthew, I'm looking at you. I will say with Department of Health and their behavioral health resources and all of their efforts that they've done in response to COVID and developing different guidance and recommendations and different documents for resilience or support. It's been a variety of some of those resources and web pages you are able to translate, and then some of them you are not, that I've noticed. With some of the web pages you can, but then clicking on particular documents, only that I've noticed seeing those available in English. Speaking for Washington Listens, so that's the statewide support program that Matthew and I have been implementing, we just recognize the huge need and the importance of the marketing materials that we've developed so far and beginning to translate those. We have marketing materials in Spanish, but just know that we need to put more time and effort and energy into getting more marketing materials translated so that we can reach non-English speaking communities, and recognizing that we need to put more emphasis in that area, and knowing where our gaps are and where we need to focus more, because it can be more of an afterthought, just to be honest, and something that we need to get better at.
This is Victor. I just want to share my perspective here, being a Southeast Asian individual and working with many immigrants and refugees over many, many years. But I'm always very skeptical about translated materials, whether it's translated into Spanish or other AAPI languages. The reason I say that is because there are native speakers who actually may speak Mandarin but do not read the native language. There are some of us that are not born from in this country. So I actually do not think the translated materials are very helpful. The more effective way is actually having somebody from that culture or from that language to administer the survey through focus group or do that. And we have consumers or patients or clients who will bring the translated survey here in their native language and do not read it. So we have those experiences, and I just think that we want to be mindful to make sure that if we are administering surveys or providing any marketing materials, to think about accessibility for the individuals, that the target audience essentially. And beyond that, I just think of a very good example that King County Public Health has done recently for COVID-19. And yes, they have translated information and marketing materials on their website. But at the same time, there is a link to make it an audio file. So if you don't actually read the language, you can click on that audio file and it will play the translated language. So somebody who do not read it can actually listen to it and understand, and which is what I just think that it's wonderful to have translated materials. But if the native speakers do not read the language, I don't think that is accessible at all. And it's much more than that. We also have to be thinking about individuals who may be hearing impaired or visually impaired. So I just think that we also have to be thinking about ADA beyond that.
Thank you for those thoughts. Very true. We were doing an eviction moratorium one pager, and we were having to think about the same things. Is not everyone reads the language. You have people who can't read for other health reasons. So yeah, thank you for adding that in. I would also, to add on to that question, is and I would ask this to everybody, is there any non-digital outreach happening on mental health and resources to communities and parents and families at all different school districts? Because we know with like the digital divide going around, there's a lot of families, communities, elders, students who don't have any type of digital access. So I'm wondering, is there any type of outreach happening to those communities?
Can I chime in real quick about something?
Yes, please.
Okay, so my parents, like, they work like 9 to 9 every day, and there are my parents, there's like Zoom classes that they've been attending, and like it's with like the district, and there's like a translator from the district, and it's just like an opportunity where like the district has been teaching like parents how to like support their children and how to like help their children with everything that's going on, and they have been covering like the importance of mental health, and they have been like giving out like hotspots to families. And like I just feel like a lot of families that have a lot of children in their household, they don't really have time to read over stuff because they're just constantly working. But for them to like sit down and be like on a call and just listen, it's more relaxing for them because they can just lay in bed or they're just sitting down and they're listening and just like processing the information instead of having to like go log onto the laptop and then read the email and then respond to the email. And like I feel like a lot of families that don't speak English and that don't really have access to like laptops or like all this like technology stuff, it's still really hard for them. So like when they hear like when they hear the translation from someone speaking in English and then someone translating it into like their native language, I feel like for them they like process and grip onto that information more, if that makes sense.
No, yeah, that makes a lot of sense. It sounds like what could be useful is if districts or community-based organizations that work around mental health could maybe set up some kind of a public call where parents and community members could tune in and hopefully have it in their translated into their native language to be able to hear that information firsthand and not having to translate it themselves and then have to go through the 9 yards, like you said, of finding access, getting on a laptop, using someone's phone to get this information. Yeah, because it's goes off of what I said in my coworker Velma Valoria in the chat was just like, what about the folks who don't have the digital access? And like you said, a lot of these families, are essential workers and they don't have the time to sit here and go through all of the nitty gritty to find out the information they really need. So that sounds like something that organizations should put together. We'll have to talk about that some more. So all these questions kind of bounce off each other. So kind of going what you were saying, Eva, was how can parents be or educated, or what are resources that are accessible to the many to know about like suicide prevention and resources to use for their kids? We've been reading a lot that there has been a spike in suicides in younger adults, in youth and children, and that with COVID-19, a lot researchers and experts fear that could go up. And so how can we help families as best as possible with this? And I feel like that's a question for everyone.
Yeah, I'll jump in here. I would say that I think it's not a matter of if the numbers will go up, it's a matter of they will go up. I think that it's really important to point out the fact that these high school students, the things that are motivating them are no longer there, right? Their social life, prom, graduation, all these types of things that might not ever go back to normal are directly impacting these young people. And it's not a matter of if, it's a matter of when. And I think right now, the most important thing is being proactive, right? And I think that along with utilizing resources in your area, in your community, it's also about creating safe spaces and kind of adjusting our expectations as adults of what these students can really manage, but also kind of really focusing on the wraparound type of service of including the parents, including people in the household and other supportive adults in that student's life to be able to create almost like bowling bumpers, right? Like you want to provide some sort of bouncing room to breathe, but also just like, hey, we're here. Like, we see you, we acknowledge you, we see that you're having a hard time. Like, what can we do? And really providing that one-on-one support. I also think that it's really important to make sure that everybody who is a part of that specific student's life, or whatever the case may be, that everybody's on the same page of what it means to actually support this young person, and realizing that every student is going to be different. Just because one student wants to go to therapy doesn't mean the rest of the 20 young people that you're talking to want to as well. So it's almost like trying to really get creative and really kind of having that case management thought process of like really tailoring action steps that are specific to that student and what makes the most sense in terms of their levels of accessibility, understanding, and just even what their home life is like, right? Because not everybody has a two-parent household that is both, bringing in two forms of income and X, Y, and Z. And so it's really kind of realizing that, you know, maybe the student lives with their grandparent and their grandparent works full time at 2 different jobs and, you know, all this other stuff. And so the student is home by themselves for more than at least 20 hours a day. So it's really trying to cultivate a sense of problem solving and creativity of how you're connecting with that student, and really making sure that everyone around them is on the same page as well.
Thank you. Victor, would you like to add on to that?
Sure. So I love acronyms. So I will give you an acronym ACT for ACT. So A stands for acknowledge. I think the first thing that when we're looking at signs and symptoms of behavioral health issues or suicidal ideation, the first thing that whether it's an educators or family members, then acknowledge that issues, acknowledge that challenge, and then truly listen and empathize and figure out whether there is a way that we can provide that support. And sometimes we have the tendency of trying to intervene before it's even us. So I think we need to be respectful in that, respect that space. So I think that the key is to acknowledge first. The C for X stands for care. So truly care and be authentic about it. And for example, during this pandemic, the questions that we are still being asked on our day-to-day life, whether it's to a young person or a co-worker, is we tend to still ask people, how are you? And I have to tell you that I no longer know how to answer that question. Are you asking me, should I be saying COVID okay, or how are you? So I don't know. But in a sense that if we respond in a caring and authentic way, I think people will sense it and truly mean it. And after you acknowledge it and provide a caring way to empathize with that situation, whether it's mental health, alcohol or use disorder. I also think that working with youth is one of the hardest population to work with. The reason that I say that is because working with youth oftentimes involves working with the whole family and sometimes even extended family, right? So I hope you're still following me. I'm trying to figure it out. So the A, the C. So the T then stands for tell or treatment option. So if there are options that we can provide, then again, do not be intrusive. If somebody do not want, it's not at the time that they want to receive any referral or treatment recommendation, I don't think we should prescribe it and force on the individual, but we certainly can provide and share the treatment recommendation. And one thing that I can think of is that if we're talking about any kind of behavioral health services, sometimes people misunderstood that the crisis connection helpline is only a line that you can call for crisis. That's true, but at the same time, it's also a helpline that you can actually call to access 24/7 behavioral health services. And they actually has a designated teen help link line that is specifically for youth as well. So I hope you remember this acronym ACT, Acknowledge, Care, Treatment.
With the hotline, something that I've been noticing lately is with the hotline, it takes a really long time for you to even be accessible to talk to somebody. So sometimes the hotlines aren't always effective because when you have like an adult that you can just go to and talk about and that cares about you, it's faster and easier to talk to them than to wait on a hotline. And then now you're sitting here waiting in your thoughts and you're just overthinking everything. And like I feel like that's where something with the hotline sometimes it's not really effective, because with the hotlines you're just sitting in your thoughts, and that's really like, and sometimes it can take up to like 30 minutes to an hour. Like I've had friends that like just came to me instead because the hotline was taking too long. And then I feel like with kids having connections like with other adults other than their parents, because not a lot of us kids can trust our parents, can go to talk to our parents. But if they had like that one stable mentor or teacher or adult, then it would just be so much easier, and like the adult then can intervene and help the student out instead of a hotline when you're just talking to like a blank wall because you don't know who the other person is. There is no connection. And like I wouldn't want to listen to somebody that I don't have a connection with. Like that's basically like me talking to a stranger, you know?
I agree with you. I would say that the helpline, I wouldn't recommend it as the first option. I completely agree with you that if there is a colleague, a peer, or a friend, or a family member, that is, like you said, that it's not a stranger, that can be somebody that is of resource, I think that would be the best person to lean in for support. I reference the helpline is more as, I don't want to say an extreme option, but sometimes there are really times that somebody cannot get hold of that trusted individual that they can relate to, and then they just need to speak to somebody. And I understand about those wait time on the helpline. And I would say that I think there are some county folks here on this Zoom call that goes back to the shortage in behavioral health workforce. There is just not enough behavioral health workforce. And if we're talking about BIPOC individuals who are doing the behavioral health work, is even a greater issue here. But I agree that the helpline is not the first option. I would recommend and agree with you that it should be somebody that is a trusted adult. It doesn't have to be somebody that is professionally trained, because oftentimes, sometimes what we need is a listening ear. We're not really looking for solution. Having somebody who can listen is sufficient to provide that interim support.
And I feel like there's so much marketing on like hotlines, on like mental health, like flyers and stuff. It's always a hotline, a hotline, a hotline. And like I feel like instead of marketing hotlines, you can like start marketing like more like productive, like innovative ways, like connections, like with a trusted adult, with like school going on, and what every single person has advisory. Every single person has advisory. But if you have that one advisory teacher that cares about you, or that one teacher you can go to, and that one person, and you can access them anytime, that is gonna be more effective than all these like hotlines, all these like booking a time to even speak to your counselor or something. But having that adult that's available like 24/7, I feel like is just gonna be the most effective way with everything going on right now to help a lot of us teens with mental health and with how we're feeling and our stress level, our anxiety levels, and our depression levels.
This is Amanda. I think you make a really, really, really good point with that, with maybe hotlines or support lines maybe not being as effective for young people, but even just having conversations, kind of looping in counselors and asking young people, like posing those questions. Do you have a trusted adult that you can reach out to? Do you have that connection? Like even just sort of planting those seeds and posing those questions just in general, even maybe from like a larger kind of marketing perspective, especially as we go into the fall, just asking young people, like, yeah, do you have that adult that you're comfortable talking to? Do you feel like you would know where to start if you wanted to meet with a mental health counselor or wanted to go and get a drug and alcohol evaluation, like those kinds of things? Velma, I'm reading your, so Can Washington Listens fund counselors to help out in schools? So with Washington Listens, we have been implementing that for a very short period of time. In our first kind of plan of action with COVID-19 and having to implement this program remotely or virtually was to develop this support line. So we have support specialists and behavioral health providers around the state staffing this support line, but we also are moving into the next phase of this grant where we have all of these folks around the state. Some have behavioral health backgrounds and are starting to encourage them to think about those outreach efforts and how we can build out support groups and how we can make connections with schools and school districts and just have the right messaging, thinking now about all the importance of all of that language and those conversations around resilience and self-care to gear up for the harder times that we're anticipating as we go into shorter days and holidays and those kinds of things. So with Washington Listens and the staff that we have, they can absolutely make connections with schools and figure out, start those relationships to figure out how we can kind of incorporate and let folks know more about the program, to have those like one-on-one conversations, or going back to, you know, maybe seeing the value of co-leading support groups with young people, and having folks get together just to talk about and to share their experiences, but then also to give them skills in thinking about you know, what ways that they can kind of manage their emotions and like those kinds of things. So creating that space to share, but then to also create some skills that folks can take away as well. Yeah. Sydney, I like your comment.
Thank you. So I'm going to, I have another question. This is for Matthew and Amanda, and I'm going to invite my coworker Samet and/or Velma Valoria to talk about this further. But how much money of the 8 million will go to communities of color for, I believe it was outreach, Samet?
Yeah, thank you, Bernica. Hi, Amanda. We're just wondering, again, going back to our previous conversation, we know that you all have been awarded monies to upstand the Washington Listens program. And then I think there's a couple more million that's coming from the federal agency, but we're just wondering like how much of that money would also be reaching out to non-English speakers and other communities of color. And I know you have a majority, not a majority, but like a good number of folks that are doing work with you to reach out to the Native community, but we're just also wondering like what else is being taken into consideration to support the non-English speaker and the communities that don't have access to that.
Yeah, with where we are at right now with the submission of the application and having conversations with FEMA and SAMHSA about our proposals, some of those conversations, I think initially we wanted to have cultural liaisons around the state to be that kind of partnership, have that relationship to communities of color or non-English speaking communities. And we, from the federal level and in the crisis counseling program, having a hard time with thinking about how to implement the program virtually. I think just across the board, we've been really just having a difficult time a little bit with how you implement a crisis counseling program in our virtual environment, since typically this is a program that you would implement boots on the ground, like kind of post, hurricane or earthquake or something like that. And so with what we did get support from FEMA and SAMHSA on was to partner with you all to think about a pilot and to think about specific communities that we wanted to reach out to and to see how effective we could be, and to show to FEMA and SAMHSA that this is effective even in our virtual world, and being effective in reaching out to communities and kind of showing that what we're doing works and we're reaching folks and providing the support that they need, and then being able to build off of that. So as far as the larger amount being awarded, we really didn't get, I think they're going to provide some funding for us to contract and do some training for staff, and then to do kind of a pilot project to share, this is how we would implement this program or type of approach to reach non-English speaking communities, and to show that that works, and then being able to build off and go from there, versus implementing it statewide and thinking about kind of across the board how we could effectively do that.
Sure. Can I
Amanda, this is, oh,
sorry.
I'm sorry. Go ahead.
Yeah, can I ask a follow-up question real quick too? Sorry, Vilma. You know, SAMHSA has invested money into these types of projects in different capacities before. So why do they need like some type of like pilot project to say that there's investment? Because I mean, Neighborhood House, I'm sure probably ACRS as well, but Neighborhood House has been funded through SAMHSA dollars to reach out specifically to communities of color in different like behavioral health and also other health aspects. So I guess not a question, kind of a question for you, but kind of a question for the overarching stuff that SAMHSA is pushing out. Like, why do they need a pilot project when this has been going on for decades? And they know that there's a need for it.
Can I follow it up too? I mean, you've got two organizations right in front of you that are doing this kind of work, ACRS and the Community for Youth, right? They're already doing this kind of work. So why not look at them for funding? Eva has been really, really good about what you can do. We asked that question and she's saying, you know, you need to be creative. Kayleen was saying, take a look at TikTok, right? And try to figure these things out. These are already suggestions that are being given to you. So why do you have to do a pilot project when you've got organizations that are there? You know, it's really, for me, it's institutional racism. Let's call it out, okay? Because you've got these people that are people of color that are saying, this is the work that we are already doing, and a white-led organization or agency is saying, we gotta do a pilot project. You don't even look or see these people in front of you. It's kind of like you're blind. And you know, and I'm really sorry because every time we go through this, I have to call out people. And you know, I'm tired of doing it. You've got communities that are already doing the kind of work that you want done.
Yeah, I don't disagree with you. I think trying to channel them and thinking about with the crisis counseling program having trouble with just the virtual component and just being a little bit, I don't know, hesitant. But I just, with this, the state that we're in, with where we're at and where we're moving forward, I want to continue this partnership. I want to show that this is working, give us more money. And unfortunately, that's kind of where we're at right now, but I don't disagree with you that there's value there and that we, yeah.
So you've got $6 billion that are coming up. Just take a look at Community for Youth and ACRS and AVA's group.
From a student's perspective, me myself, I go to ACRS for counseling, and I'm also in Community for Youth. Like, I met my mentors through there, and I feel like they don't get enough funding, and they do so much on their own time that the people that work for the organization, I'm pretty sure they don't get paid that well. They want to do it because they care. And I feel like there's just all this money just sitting there, and like, what is the point of doing a pilot project when they've been doing a pilot project this whole time? Like, it's been working. Like, the kids, if you talk to the kids that are part of these programs, and if you talk to like all these individuals, 9 out of 10 times, I can tell you and guarantee you that the programs have been a positive impact in their life. Like, that's the only thing that they might look forward to after school. Because I know I look forward to going to Community for Youth after school. Like, I look forward to being in that big community space where I can be myself, where I can open up and like just take a break from school, taking a break from my family stuff. Like, when I am part of these programs, I feel like I can express myself in so many different ways. And like, if there is that much money just sitting there, and the programs have been successful and the programs have plenty of people in it, I just don't see the need of why you guys are just holding the money and just doing all these pilot runs. But that's just how yeah.
Yeah, and I just to jump in here too, I just also noticed that we've been doing the program for 35 years. This is our first year doing it virtually, and we've had a little bit of a test pilot run last year from having to switch our mentoring program from in-person to virtual in the midst of COVID happening as it was happening, right? And so being able to find the right types of supports that will help support a virtual learning connection as well as a connection with our mentors has been something that we're already doing, something that we're successfully doing right now, and continuing to do that, and also finding different ways to provide that type of connection, which means more programming and more opportunity for providing more resources for our community that we already are a part of, that we're already connected with and we're already growing with. And so it is unfortunate to not be a part of those conversations or to be able to be seen as that type of resource in the community if when it comes to funding and that type of thing. But I think it's, you know, it's all about the work and all about trying to continue to build connections and allow youth to really be themselves and be able to create platforms like this for EVA, I think too, and people or students like EVA.
Yes, thank you so much, everyone, for sharing all of those great thoughts, especially like Eva, you're killing it, and it's amazing. It's great for us to be able to hear student voice specifically, because majority of these issues that we talk about on a bi-weekly basis in these lunch and learns are situations that students and families are going through directly. And so if we really want to root out, you know, where are the problems, what are solutions, it starts with student voice and community voice. Yes, I'm going to check the chat I would love to open it up to if folks have questions. I did see that someone mentioned, is there a way of implementing more big brother, big sister programs between college age students with younger teens? And I'm not sure if any of the experts on the call can speak to that.
Yeah, I can jump in here. So we are doing, Community for Youth is very similar to a Big Brother, Big Sister program. We're already working out of the local South Seattle public schools. So Cleveland, Franklin, Rainier Beach, Chief South. We work with Nova. I mean, we're all over the place in the South End. And our focus is really connecting mentors and adults in the community, in the Seattle community, directly with a student. The best part about our program too is that we really allow the students to build a connection with the mentors and pick their mentor. So we're not sitting behind, you know, different profiles and applications and just making matches as we assume would make a good match. It's really about the representation that our mentors provide to our students, because as we all know, and as what we're all fighting against is representation, and really focusing on creating different platforms and avenues for students to see themselves in our greater community and our greater society. And so that's really one of the things that we really focus on. We have, per with the Mentoring Association, there's an expectation of age difference, and there has to be a gap between the mentor and the student to really be able to provide ethical support. So yeah, we do have some college students that are a part of it, but it depends on the age difference between where they're at mentally and, you know, spiritually and all that type of stuff, to be able to be one-on-one with a student in our program. So we do provide that type of environment and that type of program, but it really does depend on just the age and just kind of the maturity, because there's a whole process that it takes to become a mentor and jump in that way.
Thank you. So I'm seeing a question in the chat from a student, and I'll just kind of word it for all students, is how can students lobby to create more resources in their district specifically? There's so much need in community, but not all students know how to create those resources and find those connections. So a good question for our experts is, what can students do to basically advocate for themselves, their peers, and their community as a whole? And I will start with Victor.
It's perfect that you started with me because I actually serve on the City of Seattle LGBTQ Commission. So I would say that if there are 5 different commissions within the City of Seattle, those meetings are public meetings that happen once a month. And right now, obviously, they happen virtually. So if you go to the City of Seattle website, you can find all the 5 commissions information. And from that, each commissioner is linked to different districts. So if you're not unclear which district you belong to and you're trying to advocate or lobby against specific resources, you can definitely talk to the commissions about it and find your liaison. And then if it's something that commissioners can actually elevate, then we will support you in the process to even talk about how to advocate and organize policy papers. And we really welcome individuals to attend the public hearing. So that's one example that I can provide.
Matthew or Amanda?
When it comes to like disaster resources like this with the crisis counseling program, they're set up very, very quick. We had 2 weeks to respond after a presidential disaster declaration to get an application in. And the crisis counseling program itself is a very narrow program meant to build resiliency and help people in the immediate aftermath of a disaster. Going forward, we're going to hopefully improve our disaster behavioral health plan from everything we learned from here, and we'll be able to bring in more avenues for outside voices that aren't traditionally in our mental health system or at the forefront. Other than that, and for future opportunities, contacting us directly and saying you would like to participate. When we had that 14-day period, we had to put out a call and basically worked with anybody and everybody we could that was available and willing to work with us at that time. We were able to bring in a couple tribes. We had a few more that were unable to stick with us due to the time it took to get our application approved. We were under the impression it'd be a 1 or 2 week turnaround time, and it was over a month. And in that time period, in the early COVID days, everybody was worried about staying afloat and getting their staff safe and with tasks to do. So unfortunately, we weren't able to reach out enough. We did try to include another proposal in July, and we submitted it to FEMA. And FEMA told us that we couldn't fund that it was outside the scope of the crisis counseling program. And so I think going forward, we'll just have better discussions around how we can include you guys in with the disaster funding. But going for future programs related to SAMHSA grants and those things, working directly through the grant officers and submitting proposals to HCA, to your local jurisdictions about your plan, and really just staying on them to keep their attention. Every year or in the spring, we submit new proposals to SAMHSA of programs we're going to fund, and SAMHSA tells us that's within our scope with the block grant money or not. But with SAMHSA's regular funding, there's not a whole lot of things, as long as it deals with mental health or any behavioral health issue really, that they won't fund. And SAMHSA is very open about trying to increase access for people of color, traditionally underserved populations. It's just making sure that you get that funding request to the people who can submit it, which in these cases is the Healthcare Authority, and in some cases it's DSHS. And just working through those channels to make sure that those priorities move forward. that's, and you can also do that. The ASOs get a certain amount of funding from our block grant to do programs locally. You may have more success working with local people. But again, just finding out who operates those programs and who can submit those requests, and working with them to lobby and make sure that your requests are included. And that would probably be the best I can say about lobbying.
So Matthew, the other thing that I wanted to check in was about what you were saying is, what type of outreach is done to the communities to inform them that there are these grants that they can access?
Every community does it differently. I'm from Spokane originally. When I was in Spokane, it was a BHO, and they would do regular community meetings. They post I think they'd usually call them just monthly meetings, and in the agenda, there would be discussions about future programs, gaps, that sort of thing. The Healthcare Authority, we haven't been able to do them for obvious reasons this year, but we do town halls where we go out through the Office Recovery Partnership and meet with people in the community to discuss options for improving services, finding out where the gaps are, and those are the type of places where you could bring up ideas related to programs, funding. Trying to remember, but for the disaster ones, those tend to be very, like I said, very quick turnarounds, and hopefully we'll be able to integrate you guys in future disaster planning earlier on, so that we don't face situations like this where we had to basically run immediately and just start getting the program up and running, and then, you know, have a gap in the services. But there are also some limitations when it comes to disaster programs of what we can fund and what we can't. And that's true with SAMHSA grants as well.
So I wanted to share a comment from Cynthia in the chat, if people didn't see it, especially our young folks, which is, young people, you can always email, call, write, or even schedule a meeting with your city council members about the issues you are concerned about. Ask them what resources are available and feel comfortable to tell them what organizations you feel aren't getting the support they need to provide services. Whether you are a voting age or not, the elected officials work for you as well. Use your voice, let them know what your concerns are, and ask them to make sure your concerns are addressed through their funding allocations. Way to go, youth. We need you, which is so true. So I wanted to make sure that folks heard that, so that you know that you can contact, because I think even for me, before I was voting age, I didn't think I could do any of that.
And that's a really good comment. And to add on to that, if you're looking for mental health resources, find the mental health leaders in your community. Even work with agencies. Sometimes agencies have more pull than just working with the agency, with a administrative service organization or a local public health official. You know, just really reach out, think of the area that you want to target, and reach out to those leaders and, you know, bug them, drop them in an elevator and talk to them. It's perfectly okay to do that.
This is Amanda. To add to that too, being a part of the Children, Youth, and Family team at Healthcare Authority, we are always wanting to invite young people with lived experience to the table when we're talking about changing policy or different legislative bills and different ways to improve behavioral health care. We have struggled a bit to try to find participation when this is our job. We're getting paid and we're having a hard time with reimbursing young people for their participation. So that's been a bit of a barrier at the state level, but we're always wanting voices at the table for youth to learn about their experiences and to see how we can improve behavioral health care across the state.
So a question that I have is, between Community for Youth, ACRS, Washington Listens, are any of your organizations working towards any legislation around mental health for our youth and communities this coming session?
Washington Listens is not looking for any legislation. We're a short-term crisis counseling program. So in theory, if we get funded in for the long-term services, which looks very likely in October, it would run for about 9 months. So we have no legislative asks.
This is Victor Low from ACRS. So at ACRS, we actually have a civil engagement program. And yesterday, I think some of you also attended our AAPI Democracy Summit. I will share the information that if we're talking about behavioral health legislation, we have a very inclusive process that we work with community partners and coalition statewide, Asian Pacific Islander Coalition and other stakeholders, and make sure that we get inclusive feedback from everybody before we finalize those agenda. That said, though, I would say that when it comes to behavioral health advocacy, it's always very front and center to ACRS, and one of our largest program and longest program at ACRS is actually our adult mental health program of behavioral health department that started in 1973. And I would say that we are still in process of trying to figure out. One thing that I would say that is pretty consistent is if we talk about behavioral health or mental health care, for providers on this call will definitely agree that behavioral health providers or mental health providers historically has always been underfunded, which is why there is continuing to be a major workforce retention and shortage issues. And I say that with the pandemic, it's going to trigger even maybe even more workforce retention issues with increased behavioral health and mental health needs. I know what I said is pretty general, but I would say that we haven't really finalized yet, but it definitely is something that we will work with our partners with the inclusive process and continue to advocate with an equity and social justice lens.
I feel like there are a lot of these programs, but students and youth don't really know about it because I feel like everything is always on email. Everything's always on email, and we always have to adjust and come to the level of the adults. When right now it's a time where we're not focused on, oh, let me try to get my stuff together, let me check my emails. Like that's not what we're focused on. And I feel like well, a lot of these programs, like there are plenty of programs going on, but not a lot of youth know about it because the outreach and the way that you guys are trying to like get youth is just not an effective way. And I feel like more effective ways are like I don't really know how to explain it, but I just feel like the effective ways of like email is just not an effective way of learning about a program. And like before, I know like there was like we had groups like ACRS used to come to our school like once a week. There's like a girls group and a guys group, and we're like you could like talk to your peers and see them at school and support one another. But I feel like right now it's not advertised in a way where students know about the boys support groups and the girls support groups, and sometimes you just need like a support group and a space where you can talk to people, but the opportunity right now is really like low because it's not spread out there to a way where you know about these programs.
Thank you. So I want to open up in our last few minutes to any participants. If you have any questions you would like to ask, comments, concerns, as well as our panelists. Don't everybody speak at once.
Renika, can I ask a question?
Yes, please.
Thank you. The question here is for Amanda and Matthew. Amanda and Matthew, is there a way that we can find out how much the from the state level or from the healthcare authority, how much of the dollar amounts that are invested into mental health for Washington State are going to BIPOC communities and youth from BIPOC backgrounds? Because I read somewhere that yearly, it's about $900 million of investment, but I'm not sure what the breakdown looks like when it looks at the demographics of people being served, particularly because the second and third largest non-English speaking languages are Chinese and Vietnamese, and the first one is Spanish, of course. So wanted to check in and see what those figures look like.
That's a good question. So trying to kind of think about funding allocation, Medicaid funding kind of from healthcare authority goes through the managed care organizations for kind of Medicaid services. We do allocate funds to the Behavioral Health Administrative Services organization, so different funding streams outside of Medicaid. I think that would have to be more like a fiscal and data question to gather that information. I don't know kind of numbers wise off the top of my head. I think Matthew's thinking that would probably have to be something.
Yeah, you don't have to have an answer now, but if you can get back to us and we can kind of share it with the group, that'd be really good too.
But that's also very telling, because I don't understand why you wouldn't have the answer if you're supposed to have the money, right? It's kind of like if you had the money, you would see how much is going to where. Like, I know you guys have put money into the tribal communities, and I think that's really great. But if you can't even see that you don't have money for the Asian American community, for example, and then to even mention Medicaid, does that mean that every person of color is under Medicaid? That's a real problem, if that's all how you view us.
No, the reason we mentioned Medicaid is because that's our primary function. We're the state Medicaid authority. So the majority of the funds that we would work with would be Medicaid. We also deal,
the question was around how much money is going to the BIPOC communities, not Medicaid.
So let me just piggyback off that. So I think the broader question here, and thank you, Velma, and thank you, Eva, is that when you are in a position of doling out funds or policies and programs, what policy do you have that's inclusive already to make sure that marginalized communities like BIPOC get their share of those resources? And if you don't already have a policy in place to ensure that that's happening, then something is wrong. So even if the majority of the funding that you get happens to be through Medicaid, then you have to ask yourself a question. If the only way people are going to be able to access these mental health services is through Medicaid, what about those people who don't qualify but still have mental health needs, right? And then if it is under Medicaid, you should be able to say what percentage of funding are going to those that primarily serve BIPOC communities. That should be a very good data. And if you don't have it, this is not a personal attack. Excuse my passion if it is conflicting with understanding the issue. But the issue is, if you don't have that data, why not? And when will you start having that data? And will you please make it a priority so that communities like ours in the BIPOC, so when Eva comes and she says, hey, this is an organization that works well with youth, how come they're not getting their fair share? You can address that question, right? Because this is a youth who needs those services. She's speaking up for her community. She's speaking up for her peers, our future. So for everyone who is participating, this is an equity and inclusion issue. What are each of us doing to ensure the three things that we've heard throughout this? Number one, that we have policies intact already that ensure there's access to BIPOC organizations, to the resources that we have. Two, that in our allocation of funding, we ensure that those BIPOC communities are being served, and not at a minimal rate, at least at the rate at which they're represented and needed in the community. And three, that we loop into those organizations to make sure that their affirmative marketing programs work well for the clients they serve. To Eva's point, if email is not a good way to meet our youth, what are we doing using TikTok? A lot of them are on there. What are we doing using Snapchat? What are we doing to knock on their door and let them know that they're loved and they're cared for, right? So how do we loop back in to make sure that those youth have a voice, that they are being served, and that the organizations that serve them are serving them well? I think that that is a great issue for all of us. And then to all the youth who are listening, and to all those people who feel like, and Velma, I'm speaking to you too, I'm getting tired of saying over and over again, what about BIPOC? What about BIPOC? But you know what? I'm going to keep doing it because I do have a voice. Each of us do. Each of us has a role. And you may get tired. That's okay. But keep saying it and keep asking the question, because at some point, somebody's got to realize, as a gatekeeper of resources, that if I keep hearing the same thing over and over again, but I keep doing the same thing over and over again, and there's no change, that's the definition of insanity. Why am I being insane?
And also, I know like a lot of these meetings where you guys make big decisions, it's a lot of the time the meetings are all during school hours. And like if you guys are trying to make this make change for students and youth, I feel like the youth should be able to be in these meetings to know what's going on. Like I feel like the meetings, they should give kids more opportunities to where they are able to join. And I feel like if this is for the youth, you guys should be able to adjust to the youth, adjust to their time of when they're able to have meetings, whenever they are free. Because you guys got to keep in mind, we have school to like 3, 4. And so, and I know that's like around the time that a lot of like people get off of work. But since you guys are doing a lot of work towards youth and their mental health and just youth in general, I feel like if you guys are able to switch to where you guys can adjust to the youth and have the youth say their voices, a lot of where your money is going to go to is going to be more well spent, because then there will be more youth that will be joining, instead of like maybe not even have youth at all in any of your guys' meeting and making all these big decisions. And like adults, just adult and kid decisions, there's like I feel like you gotta know both of the sides to be even to make a decision, because there's just such a big age gap and things are so different nowadays. And so to have like 1 or 2 like student in a meeting and them just be like, oh, I agree to this, or no, I don't agree to this, or this money is not being well spent, I just feel like that's really important.
Thank you for adding that in. I agree with that, especially. I think that with everything that with COVID, it's changed how most of us do everything from our basic daily needs. And almost everyone has had to transition to some kind of digital or online way. And I think that we are in one of the highest points in our history of digital connection, with social media, with 5,000 different, Google Suite, Microsoft Suite, everything. And I would agree with you, Eva, that we have to find a way, like all of us, to meet each other halfway, or to try ways that we never thought. A year ago, I never thought we would be sitting here having conversations about how to reach students on TikTok. And now I agree that, I watch TikTok, and personally, I have friends who have thousands upon thousands of followers on TikTok. And I have friends who will sit there and be like, oh man, I was on TikTok for 4 hours and I thought it was 20 minutes. So why don't we take a chance at utilizing that? If we know that students are sitting there distracted in their Zoom classrooms because they're trying the new TikTok trend, why can't I see so many professionals whether it's lawyers or people in the medical field who are doing TikToks and that are informative. So I think that's just an example of a way that can work. And so I do agree with you that there becomes a point where there's not an excuse if there's things we haven't tried that are easily accessible to try. Maybe we try and they don't work, but there has to be more ways and to reach students and reach community. And just kind of summing up some of the things on this call, just because we are at time, is for Matthew and Amanda example, is if we are, in order to have the community connection, and you say to have these conversations, you have to have community in those conversations, especially if you don't know specific types of community, different types of community, you don't have your foot in that door, you have to have them at the table to get your foot in the door to begin with. And so I will hand it over to our executive director, Sharon, if she would like to add anything to close us out. But from me, I would say I greatly appreciate all of our panelists being on this call. Thank you so much, Eva, for being a part of this. Having a student voice is actually absolutely critical to the conversation, like you reiterated yourself. So to have you on this call and to hear your voice and to speak your concerns, it's absolutely amazing and it's greatly appreciated. And then also to the rest of our panelists, thank you so much for taking the time to come on with us and be a part of this conversation. And from there, I will give it over to Sharon.
Actually, you did great. So I dropped 2 links in the chat. It's our proposal to get digital equity laptops and the internet to all of our students in Washington State. Please read the proposal. Please sign on to the form. We have 371 people signed on. We're trying to get 500 by tomorrow afternoon. I would love to get students signed on to this. So please sign on, please forward it. It is a huge opportunity for us to develop workforce pipelines for folks, especially BIPOC students who are currently in school or trying to transition to outside of service jobs or gig jobs and want to go into the tech field or hospital field or some other kind of something else. We are creating a workforce development, but also trying to get 387,000 laptops to Washington State so that our folks can get connected. So yeah, great panel. I love how this day was popping off a little. And I want to thank you to everybody. Please do not anticipate ever that I will be on TikTok, but I will follow all of you because nobody wants to see this on TikTok. But thank you so much. Thank you to our panelists, and we will see you in 2 weeks.
Thank you all from Velma.